All right, guys, we're gonna go ahead and get started. So, of course, my name is Christopher Jammer, and today we have with us Dr. Kurt Edeker and Dr. Carrie Finale, two of our providers at our South location off of Brody, to talk to you guys specifically today about knee pain. As you all saw, whenever you were admitted into the presentation, your microphones were muted and your cameras were off. That's so we can cut down on some of the background noise and to make sure that our providers are able to get you the information as quickly and as efficiently as possible. But if you have any general questions about any of the content throughout the presentation, we definitely ask that you utilize the chat function to send those questions over to us so that we can make sure to get those questions answered for you in real time. So today, like we said, we're going to talk specifically about knee pain. Dr. Edeker and Dr. Finale will go over some knee pain overview, some interesting facts for you guys. They'll talk about some common misconceptions and just the causes of knee pain in general. So kind of give you a deeper dive into what happens with the knee, how it's supposed to function, and when it has some dysfunction, what actually happens. Then we'll give you some general stretching recommendations and some exercises of how to combat or actually keep yourself out of knee pain. And then, of course, at the end, we will answer any questions that you guys have for us. So without further ado, I'm going to turn it over to Dr. E and Dr. Finale.
Can
you hear us? Okay. Hi.
All right. And like Chris said, we're with Airrosti. For those of you that are not familiar with Airrosti, we specialize in connective tissue injuries and disorders. We are all doctors of chiropractic, but this is definitely not traditional chiropractic that we work with here in Airrosti. We focus mostly on connective tissue. So that's ligaments, tendons, myofascial connections. It's basically the stuff that holds everything else together. And so it can affect you in a lot of different ways. Airrosti is a company. We've got over 200 offices now that we're scattered around Texas and a few other states. And we have virtual offices in 48 states. And we try to get people in, find out what's going on, get them fixed, and give them some tools they can use to help stay well. We really try not to adopt anybody if we don't have to. Our average for most injuries is about 3 to 4 visits. That's depending on, and that's an average. Some are a little more, a little less. Every appointment in the office is an hour long. The first part is with the doc doing diagnosis, testing to make sure that you're in the right place so we can help you out. If we don't think we can help you, we'll get you where you need to be. But then the second half of the visit is spent in rehab, where we're showing you specific ways to deal with your injury. So each rehab session is a little different from patient to patient, and we modify it depending on what you actually need. So today we're going to get into some knees. We're going to show you a bit about how knees work, some facts about them. And if you have any questions on the end, we'll have some time for that. If anybody has any questions on anything else, there's a load of good information on the Airrosti website. So let's get into it. So some good facts about knees. And this is all kind of, I love trivia, so this is kind of right up my alley. But some knee facts. The knee itself takes your body weight every step, but you've got momentum with that. So anytime you're going downstairs, anytime you're running, anytime you're jumping, you ramp that up. So knees can take 4 times and sometimes even more than that if you're doing high impact kind of stuff per impact. So if you weigh 100 pounds and you're doing a box jump, you're putting well over 400 pounds on that knee when you're coming down. So it needs to be in a good place and functioning right, so you can do your thing and keep having fun. Everyone has unique kneecaps, which is kind of interesting, and we deal with that in the office all the time. If anybody's ever had patellar tendonitis or knee pain right around the kneecap, everybody's a little different. So each kneecap has all these little tiny bumps and grooves, and everywhere you've got a little bump and groove, something attaches to it. And everybody's just a little bit unique. So you've got to kind of figure that out. That's something we try and help you with here in the office. Knees rely on about 10 major muscles to move. Basically, there's a lot of different things that can affect how a knee moves and when it needs to move, depending on what you're doing, whether you're walking straight forward, going up or down stairs, having to scramble to get down a curb or get sideways or jump over something, pick up your kids, whatever. Knees function in a lot of different ways. Exercise keeps them healthy. Basically, humans are meant to move. Dr. Finale will touch in on a bit on why there's so much more pain now than there was a few decades ago. Basically, it boils down to lifestyle. We don't move the way we're supposed to, the way we're designed to. So the body thrives on motion, especially joints. They don't have a great blood supply, so motion is literally what pumps the nutrition in and out. This bottom one, okay, babies are born without kneecaps. That's one of those trick questions. Babies are born when their bones are mostly cartilage, so they're kind of soft and squishy. Same with the kneecap. There is a kneecap there, but it's not bone. So that's a little bit of a trick question if it comes up in Trivial Pursuit. Do babies have kneecaps? They don't have bony kneecaps. They got little soft, squishy kneecaps. All right. Okay, Dr. Finale.
All right. So the next several slides, we're going to go over some statistics with you. Approximately 25% of adults are affected by knee pain. A lot of people think, I've got knee pain, there's something going on in there, but people don't realize there's a lot of different reasons for knee pain. Usually knee pain is not coming from the knee itself. It can be coming from your hips, your back, your glutes, your feet even. Unless you've taken a specific trauma to the knee, we always look at what's going on above and below that knee. The prevalence of knee pain has increased 65% over the past 20 years. What's changed? Well, we've become way more sedentary. People are sitting, like Dr. Edeker was talking about. Movement is crucial to the health of a joint. Now we're sitting 8 hours a day or more, not getting that lubrication in there. We're not standing, we're not moving around as much. And people, when they get injured, they're thinking, oh, I don't want to move, I don't want to exercise, but we need to keep motion in that joint to keep it healthy. 1/3 of all Americans are experiencing knee pain at some time or another. So this is pretty common. Knee pain is second only to low back pain as the most common cause of chronic pain. It's become a very common musculoskeletal condition, and it's one of the leading causes of disability in our population over 50 years of age. So this is something we definitely want to address, figure out why this is happening, and keep it from happening. All right. So again, we talked about the percentages, but what is that having? What kind of effect is that having? It's costing us a lot of money, right? We're spending billions of dollars in possibly unnecessary surgeries. People think I have knee pain, I need surgery. Well, that's not always the case. Again, not all knee pain is coming from the actual knee. So you can go out, spend all this money on a surgery that you didn't need and didn't actually take care of your pain. That's one of the things we like to do here. We look at the whole body, look at above and below and see what's really going on. You may not need surgery. It may be something else going on. We could definitely help you figure that out. Knee pain can affect your sleep. We don't feel good when we're not sleeping, and then we get even more pain. A lot of people are getting that, people are trying to get out there, that they are being sedentary. We had COVID happening. Everybody's sitting around, going out, trying to do some exercises. We're getting a lot of that pain in the front of your knee, what we call runner's knee. Things just aren't lining up. We've got tightness in certain areas and weakness in other areas. That's stuff that we can help you with. Figure out what's tight, how to loosen it, what's weak, how to strengthen it. Knee pain is causing people to miss more days of work, and they're becoming less productive because of it. We're not productive when we're in pain. So let's try to figure out what's going on and stop that. All right. The CDC has been talking about knee pain for the people who have been diagnosed with arthritis. It's affecting people's ability to function, how they want to do things, kneeling, bending, stooping, walking, going up and down stairs, doing your social events. And it's like kids are even saying, and not just kids, adults will tell you a lot of times, my knees, they act up, they hurt more in different weather, cold weather. That's all part of that arthritis. If you're getting knee pain, that's worse when you're first getting up after rest in the morning or affected by weather, that can be arthritis. It's something we can look at and show you how to deal with. And next, we're having, there's some stats on knee pain by age. Kids, young kids, adolescents, we are seeing more and more kids in our office because we've got a lot of athletes. Kids are doing all kinds of sports, or in every sport known to mankind. And a lot of them are coming in here with knee pain. So we figure out, again, what's weak, what's tight, help them get through that so they can get out there and be more active. look, 18 to 23% of men and women over the age of 60 are reporting knee pain. That number goes up 24 to 30% when in the 85 to 90-year-old population. Well, the majority of us are in between these age groups, but again, it all depends. Are you sitting? Are you being active? You know, knee pain is coming up. So if you have it, but you know, I suggest get it looked at. Let's find out what's going on, what's actually causing it before jumping to any conclusions, thinking I need surgery or something like that. It's always good to get it checked out. Most of the time it can help you.
All right. And so all those stats kind of lead into some of this stuff also of common misconceptions about the knee. I'm going to skip to number 2 here. Knee pain is just part of getting older. So you just saw those stats of how you tend to get more knee pain when you get a few more miles on you. I kind of try to reverse the tables in here. People usually walk in with one side or the other, right knee, left knee. I always ask, how old is the other knee? They're about the same age. What's the difference? You can also look at people about your same age doing incredible things, running marathons, hiking canyons, doing CrossFit, martial arts, you name it. So age is definitely a card in the deck. It's not the only card in the deck. There's a lot of cards in the deck. There's sleep, there's water, there's nutrition, there's exercise, there's the rehab stuff we show you and you can pick up in other places. So there's a lot of things you can do to make that age card a minor card in the deck. Now, if you've got some massive degeneration, if you're bone on bone, then yes, that's definitely a thing. Usually you can deal with it. Sometimes it does end up in a surgery. But a lot of people think, oh, I've got knee pain, I'm in for a surgery. Surgery does not always fix knee pain. Like Dr. Finale was saying, we try to look at the whole system, not just the parts. So even if you've got some reasonable degeneration, if you can improve the mechanics in that joint, you can get a lot more performance out of it and postpone or maybe not even need that surgery. When people see degeneration or problem on X-ray or an MRI, that's an indicator, but those are great tools. They are not Bibles. So just because you see some degeneration or an issue on MRI doesn't necessarily mean that's the source of the pain. Again, if you can correct the mechanics and get everything functioning that helps control that knee, you can get a lot better performance out of it. The other one, old school, used to be avoiding activity gets knees better. So old school used to be, oh, your knees are hurting, don't do anything for 6 weeks. Okay, well, they're probably not going to hurt during that 6 weeks because you're not doing anything. But you're alive, they're going to be healing up, but they're healing up in a non-moving, non-challenged, weak state. So in Airrosti, we're really going towards the newer research that shows if you can correct the mechanics and keep it moving through the healing process, you actually heal quicker and you heal better long-term. So we try and get people back into their activity as quickly as possible. If we get a runner in here with knee pain, we may have them scale back, we may have them modify, but we want them out and running as quickly as possible because that is teaching the tissue, the structures, everything in there, what to do, and then we safely get them back up to whatever mileage or distance they want to be doing. So activity is one of the things that usually helps knees and other joints get back to what they want to do. Rest is not always the best thing. And once there's damage to the knee, is it always going to be painful with arthritis, meniscus, all the other stuff? Not necessarily. Again, just because you see it on an MRI or X-ray does not mean that that is the story forever. There's a lot of people walking around, myself included, with some pretty good damage on a knee, and you can get away with a lot of stuff. I can still do quite a bit of things, and it's a matter of knowing what's going on and how to take care of it. Even if you look at the best athlete on the planet, they all have their injuries, but they know what they are and they know what to do about them so that they can manage them and still stay at the top of their game. And that's what we try and do in here is find out what's going on, give you some strategies to get it better, and then keep it good. All right, so here's a quick little diagram. And basically what this does is gives you a little idea of how many things can control or influence the knee. And in reality, it can go even higher than the hips into low back and even up into mid back, up into shoulders, depending on what's going on. But everything from the foot on up has to work as a unit. And so that's one thing we try to look at in here is not necessarily parts, but look at systems. And so for knee pain, it can be the knee itself, and we try and screen for all that, but it can also be from the hamstring, it can be from the IT band, even the glutes, On the front side, it can be any one of those quadriceps muscles, even hip flexors up into the hips and low back. From lower, it can be into the calves, any of those structures there. It can have to do with how you're using it, whether it's a running stride or if you happen to sit in one bad position all the time, that can upset the hips and work its way down into the knees. There's a lot of things can influence all this. And so that's part of what we try to pick apart here in the office is what's the cause? So the pain, yes, that's an indicator about what's happening, but what's the cause and what's influencing that? So that's what we really try to get at in here. And then again, give you some strategies to keep things balanced and good and functional. All right, so this slide gives you a lot of information. Basically, the knee is a basic hinge joint with a lot of other little complicated things that go with it. And that diagram you see on your lower right-hand side, if you boil that down, it basically tells you that the foot can influence the ankle, can influence the lower leg, can influence the knee, can influence the thigh, can influence the hip, can influence the low back, and vice versa. So one thing really kind of dominoes into the other, and it's trying to figure out what that primary domino is and then start correcting it. So if somebody comes in with knee pain, we're probably going to be working on the knee, but we may be working up in the hip, we may be working down on the lower leg or the ankle. It's wherever it needs to go to correct that problem about the mechanics. And so depending on your dysfunction, your injury, any wear and tear you happen to have, we're trying to figure out exactly what's going on in there and correct that so you get some normal mechanics, things start performing the way they should, and you can get back to doing what you want to do. All right, we're going to hand this over to our rehab people. And like I said, the second half of every Airrosti session is in rehab, where you're learning active moves to help get this better. So got Trent and Sarah. Have at it. How you doing?
Hello guys. All right, so we're going to teach you a couple exercises and couple stretches for you to just do home. Those are going to benefit you on the long term, but we need to teach you how to do them properly to target the proper muscles. So I'm going to be speaking, Trent is going to be showing you the good form first, and then the bad form afterward, okay? So the first one we're going to go over is a squat. So the proper way to do a squat is, first of all, feet are going to be spread out, hips apart, okay? After that, you're going to have your head, like your eyes and your chest facing forward. And then you're going to hip hinge. So pushing your hips back first, and then you're going to lower your body, pushing your hips back and pressing your hips outside, okay? On the outer part of your knee. And then you're going to squeeze your glutes and then push throughout the entire foot, 3 points of contact to drive yourself back up. Okay, let's do it again. So look at the form. Perfect. Feet apart, knees out, and then hip hinging, pushing your hips back, lowering yourself down, then squeezing the glutes, maintaining pressure on the outside of your knee, and then look, eyes facing forward, chest facing forward, and then pressing up throughout the entire foot. Next one. So this one, we're going to show you a stretch for your calf. So you're going to place your hands against the wall. So the leg that we are stretching is going to be placed on the back. Okay. So yes, to stretch that muscle, you need to have your leg slightly bent. Okay. Really important on this one is to keep your heel on the ground at all time. So to make it dynamic, you're going to simply do a smaller flexion and then extend your knee back, okay? You're going to repeat this a couple times, making sure that your heel is on the ground at all time. Next one. Okay, executive stretch. So Trent is grabbing a chair. So you're going to be seated. Perfect. And we're going to do a figure 4 position. So you're going to bring one leg across your knee on your other leg, really important on this one is not to put too much pressure with your hand on your knee, okay? It's a very slight, subtle pressure. You got to keep in mind to keep both of your hips and your glutes flat on the chair. Do not press really, really hard to where your hips are shifting. And then one thing you can do to get a deeper stretch as well is you're going to bring your chest back flat towards the front of your leg, okay? So try and show that motion, perfect. Slightly bending your back flat forward, okay? Next one. Okay, single leg balance. Couple things here to think about when you're doing this. So the first thing you're going to do is you want a 3-point of contact throughout your foot. So big toe, little toes, and then your heel on the ground at all time, grounded, okay? So if I was to come and push you all around, you would not move, okay? You're really grounded on the floor. So you're gonna lift one leg up, shift your weight on one leg, your weights are on one leg, soft knee, okay? The leg on the floor is soft knee. The knee is not locked out. And what you're going to do from here, you're just going to simply squeeze the glutes really, really tight, tighten your core, and then eyes looking straight in front of you, okay? You want to keep a neutral spine. You do not want to arch your upper back. Finished.
All right, so that was some good basic stuff that anybody can do. Chris, you want to talk about this stuff here?
Absolutely. So thank you guys for going through the content, and thank Trent and Sarah for going through the exercise with you guys. So if you guys have any questions specifically about any of the content Dr. E, Dr. Finale, Trent, and Sarah went over, more than welcome. Like I say, send some questions in the chat function and we can have those guys answer them in real time for you. But if you would like some more information about some general knee pain issues that you might be having, you can scan the QR code, or you could also go to our Airrosti website. That way we have a lot more information to share with you guys. So lastly, of course, at the end of the presentation, we always like to talk about general what we are and kind of who we are. Dr. E did a very good job of kind of explaining it. So for those of you who have been on the webinars before, you know, some of these statistics are going to look very familiar. But as Dr. Edeker and Dr. Finale said before, of course, at Airrosti, we always like to make sure that, number one, whenever you come into our offices, you come in with a symptom or ache or pain that we actually can take care of. And because of that, and because of how we do our treatment model, is because we only have to see people about 3 to 4 times because of the manual therapy component, and then coupled with the active rehabilitation. Generally, we see people really, really quickly get you better a lot faster. And of course, we can help avoid a lot of those recommended surgeries that you guys might have come in with. So, and today we talk specifically about knee pain, but we see a lot of different injuries come into our offices. It could be something acute, like an ankle sprain or some neck pain that you woke up with in the morning, or it could be something chronic in nature that you've been dealing with for months, years, or even decades on end, like sciatic-like pain, or maybe knee pain. It could be headaches or things of that sort. So, and lastly, of course, we are an in-network benefit for all of Austin ISD's employees, spouses, and dependents that are on the Aetna Health Plan. You don't need a referral to go see any of our providers, and all of our clinics are currently open and making sure that we keep a safe environment, not only for our treatment teams, but for all of our patients that come in. And of course, on your screen, you see Dr. Edeker, Dr. Mahaffey, and Dr. Finale's actual location. It's at 9001 Brody Lane in one of our South locations. If you guys have any questions, again, shoot those over to us. But if not, we will give you back some of your time, and we thank you guys for joining us today.